Hello everybody, I'm Ross Myers from the Center for Pediatric Education and the Division of Pediatric Pulmonology at Rainbow Babies and Children's Hospital. Today we're going to go over the proper techniques on how to demonstrate the use of metered-dose inhalers to be used with valve holding chamber spacers with both mask and mouthpiece. As a lot of the residents know, proper technique is vital to the care of patients with asthma, and so we want to make sure that you guys know how to demonstrate these to your patients and families. So first off, we're going to demonstrate the use of a metered-dose inhaler with valve holding chamber with mouthpiece. What we're going to use today for demonstration purposes is an AeroChamber brand. There's multiple brands of valve holding chambers out there. This is, again, just being used for demonstration purposes. So we start using the valve holding chambers with mouthpiece right around the age of 5 years, which is when kids are able to follow directions well enough to get a good mouth seal around this mouthpiece, and I'll show you guys that in a second. So when you're using these for families, first thing you want to do when you're describing the technique is to have them shake up the inhaler first. This helps get the medication sort of more diffusely in the suspension here inside the metered-dose inhaler. So shake that up first. Open up the mouthpiece here. And the best way to do this, again, after you've shaken this up, put it into the back of the spacer here. Have them exhale their lung volume as best they can. You want to get down to lower lung volume so that when patients take a deep breath in, they're able to do that from a lower lung volume to get that larger deep breath in there. So have them exhale their lung volume, get a good mouth seal around the mouthpiece, and then depress the inhaler. So here, just like this, depress the inhaler, and then slow deep breath in. A nice breath hold for about 10 seconds. And then exhale. That breath hold's really important so that that medication they've just breathed in is able to settle down onto the lower airways where the medication really needs to go to work. So again, quicker time span here. Shake up the inhaler. Put it into the back of the valve holding chamber with mouthpiece. Have the patient exhale their lung volume as best they can. Get a good mouth seal on that mouthpiece. Depress the inhaler. Slow deep breath in. Breath hold for about 10 seconds. One of the common pitfalls of use with a metered-dose inhaler with valve holding chamber and mouthpiece is that the patients breathe in too fast. If they breathe in too fast, most of that medicine is going to go to the back of the throat instead of going down to the lungs where it needs to go. And I'll show you what happens with that. Most of the valve holding chamber spacers with mouthpieces are going to have a whistle on the back. So I'll demonstrate that for you now. You do not want the whistle to go off. If the whistle's going off, then they're doing the technique improperly. I'll show you here. Now, as you can see, I took a faster deep breath in, and with that, the whistle went off. A lot of kids like to hear that sound, but you want to educate the parents and the patients that if they hear that sound, that their technique is not proper. So again, shake it up, put it in the back, have them exhale their lung volume, get a good mouth seal around here, depress, slow deep breath in. Breath hold for about 10 seconds, and then exhale. Okay, that in a nutshell is how to demonstrate a valve holding chamber with mouthpiece. Next, we'll go over a valve holding chamber with mask. Again, this is an AeroChamber brand here. This is AeroChamber brand with medium face mask. That's the majority of kids from about the age of 6 months to around 5 years of age are going to fit nicely with the medium size AeroChamber with face mask. Patients who have some craniofacial anomalies may do well with a smaller face mask, and older patients who have some neurocognitive delays may do well with a valve holding chamber with large face mask. That's why having these in your clinic is so important, so you can double check technique and make sure that you have a good fit size. So with this one here, your technique is going to start off in the same way as what you did with the valve holding chamber with mouthpiece, where again, you want to have the parent shake up the inhaler, put it into the back here. And the reason to use a face mask is when you have kids who can't get that good mouth seal and can't really follow directions well to do a good technique with the valve holding chamber with mouthpiece. So what you do here is to get a really nice mouth seal. You want to get a good face seal, with the mouth and the nose being inside of the face mask. So once you have that done, you have the family depress on the inhaler and watch the patient breathe about 6 to 8 times. The nice thing with the AeroChamber brand here is that you can see a flap move right here. You'll see this yellow flap move as we go, and I'm going to exaggerate a patient moving. Again, this flap is going to move as the patient breathes in and out, and so you can have the parent count the number of flaps, number of times the flap is moving, instead of counting the breaths themselves. So again, have the parent shake up the inhaler, put it into the back of the spacer, get a good face seal, depress, watch the patient breathe 6 to 8 times, and that is your puff of inhaled medications. So hopefully you've all found this video helpful. If you have any questions, please feel free to email me, page me, call me, contact me. It doesn't matter. I'm happy to help with whatever I can. I hope you found this video helpful. Please, again, as I stress with a lot of my residents, really making sure that you describe and demonstrate proper inhaler technique is vital to the care of your patients who are on inhaled medications. Thank you very much.